Sarah, over to you.
Thank you so much. I want to echo your thanks, Tatiana Yasinska. Really, really wonderful roundtable on the role of innovation and entrepreneurship in Ukraine's post-war recovery. Thanks to all of the participants for sharing such relevant, timely, and important information with us. With that, we will move from one roundtable to another. So I'd like to introduce the next roundtable, which is equally interesting, timely, and important. The topic of the next roundtable is mental health support during the war, ongoing and future challenge. And I will hand the virtual microphone over to our wonderful organizers and moderators for this roundtable, Hanna Schwindina and Ihor Prihodko. So please, really looking forward to your roundtable.
Good evening, everyone. Thank you for joining. Thank you, Sarah, for giving us an opportunity to discuss mental health during the war. First and foremost, I will reveal the cards and I'll introduce the participants. For those of you who would like to ask questions, please feel free to do so. We have our own script that we will follow. I will co-moderate this panel together with my colleague Ihor Prihodko. Okay, let me introduce myself first. I have a PhD in economy, but I'm also the executive director of CEO Lifelong Learning Center from the city of Sumy in Ukraine. And our projects support mental health of the city of Sumy residents and this Sumy region. Ihor Prihodko will be my co-moderator. He has a PhD in psychology and he works in the National Academy of the National Guard of Ukraine, based in Kharkiv, Ukraine. So we have two regions represented here today, Kharkiv and Sumy. The roundtable participants are Victoria Ratieva, has a PhD in pedagogy. She's the head of the pedagogical service in the city of Sumy. Victoria Tsukareva, a PhD student at the moment. She has a master's degree in psychology. She's also a psychotherapist and a psychiatrist and works in the Sumy Oblast Hospital for War Veterans in Ukraine. Alexander Vasilkovsky, he is an associated professor of the Educational and Scientific Institute, the Institute of Public Administration, under the Karatyn Kharkiv National University. Vitaly Kristenko, representing an NGO, Ukrainian Center for Psychological Assistance and Support, Indestructible Kharkiv. So, these are our roundtable participants. I'll ask the questions first, and then we will have a ping-pong session, so to say. So, my first question is to Ihor. Ihor, could you give us an update on the status of mental health support for Ukrainians? Can you debunk some of the myths that stand in the way of providing this support? Good afternoon, good evening, colleagues. I cannot give you a straight answer. With the beginning of the Russian hostilities against Ukrainians, the mental health of Ukrainians has changed, all of them. Let me outline the recent trends of this change, and let me give you an update on the mental health status of Ukrainians. 3 years into the full-scale invasion, the UN System Coordinator, Matthias Mali, named mental health crisis a chief national problem. Is this really the case? How things really stand? Well, the first mental health survey of Ukrainians who remain in Ukraine was announced in 2022, the findings say that 40% of the respondents faced health threats personally, and general mental health welfare assessment was fairly optimistic, with an average of 6.7 out of 9. And at least the majority of the respondents has at least one symptoms of mental health, and 57% faced the risks of facing significant mental health problems. Further research was conducted in 2023. Approximately half of respondents said that their mental health status was average, sadly inaudible due to poor speaker connectivity. The interpretation cannot be rendered. And 38% decided that their mental health was fairly good. Next year, 13% decided that their mental health was below average, and only 36% were in average mental health. So more than half of our population does need mental health assistance. According to some estimates, more than 3 million Ukrainians have some kind of mental health disorder. 800,000 have severe mental health disorders. In order not to be scared and to perceive the facts reasonably, let us look at the WHO data covering the global population. In 2019, every 9th person living on Earth had a mental health disorder. In Ukraine's figure is 1 in 13. So we can see that the data in Ukraine in 2022 is not ghastly. However, we live in times of total uncertainties and negative forecasts. Therefore, mental health of Ukrainians is ever more urgent in terms of issues. So what is the status quo? How do things stand right now? In the first months of 2022, we could outline the stage of maximum stress. 3 years into the full-scale invasion, this has become a long-term stress, which is negatively impacting the mental health. So the stages of stress reaction are as follows. First, mobilization. People think on their feet and try to overcome the problem in one way or another. The second stage, adaptation. An individual normalizes their processes more or less. Functioning is adequate given the circumstances. And the exhaustion stage. This is where Ukrainians are right now. If the stress lasts for a long time and is very acute, this results in lack of resilience and mental health problems. Therefore, it is no surprise that early in 2025, many Ukrainians witness the decrease in their mental health well-being because the distress is protracted and we cannot see a positive scenario for the future. But even so, anyone can become more resilient by shredding a range of negative stereotypes and myths. Myth number 1, pretend everything is normal. Force yourself to do things even if you cannot. No, this is a misconception. You shouldn't have fear of experiencing your emotions. Do not ignore your feelings. On the contrary, experience them. Make sure you're aware of where you are. But you shouldn't give in to the emotion in full. Try to do things that your body can do. Myth number 2, everybody would have a post-traumatic stress disorder. Even mental health practitioners tend to overplay the figures of PTSD. Allegedly 20 to 30 people would have PTSD. But you should differentiate between some signs of PTSD demonstrated by many Ukrainians are not tantamount to the actual PTSD. Not, in most cases, you would look at mild disorders. PTSD is caused by distress when faced real danger. It is impossible to get a PTSD by reading the news feed. It's a different form of mental health impairments. And myth number 3. Things cannot be helped. Therefore, you shouldn't do anything because the accessing mental health support is difficult. Actually, there are a lot of ways to make sure you improve, and you can do it single-handedly. Self-help methods are abound. So I suggest that we expand on it at the end of our panel. Thank you, that's it from me. Ihor, thank you for your introductory remarks, detailed remarks, and now we go to the Q&A session, and I invite all the participants. Maybe you have a burning question, or if you're afraid you'll forget about the question, feel free to put them in the chat. I will definitely read everything that's in there. And now I have a question. A question to everybody, in fact. What do you think? How has the war transformed the public idea about the importance of mental health? Maybe you can outline some key needs in terms of mental health. And I'd like to address this question to Victoria Rateva first, then I'll go to Victoria Sukharova, and then down the list, as you can see it in the chat. So Victoria, you've joined. So, how has the war transformed the public idea of the mental health? Hanna, we've been active since 2014. With the full-scale war, the focus has somewhat shifted. And I'll echo Ihor here. We're doing awareness raising, we're doing prevention, and we are fostering self-help skills. Therefore, today we do a lot of training sessions, outreach, we put together guides and handbooks. Our goal is to teach an individual quickly and let them master self-help technique. So where mental health cannot bear the stress, the physical body would be affected. Therefore, new technologies emerge, new techniques create, and Victoria is an excellent speaker on that topic, and therefore we try to make use of that. There was a wonderful meeting, I recall, where Victoria delivered her training that she designed herself, and the target audience were the soldiers. So how can you teach and deliver the message across that sometimes your mental health is insufficient and therefore your body would be physically affected? You have 6 to 8 hours to teach them some self-help. And this is exactly what we're doing jointly with you to, in the framework of the projects implemented. I think what we're doing is an excellent job. It's robust because it's evidence-based, and some achievements have been attained. Mostly I work with young people. Since 2010, I am the head of the mental health support service in the Sumy University. And after COVID broke out, we've had 5 years of e-learning, remote learning. We've had that experience, and that might adversely affect mental health. Not just the university students, but also the faculty, where we rarely see each other in person, where we rarely can meet people on site something that we yearn to do. Therefore, you need to address this matter comprehensively. It's wonderful that Olena Zelenska has started a support program. How are you, the Yuck? It's wonderful that this outreach is there, but more effort is needed. I'm a mental health practitioner. That's why I believe it's so of such a paramount importance, and I believe these programs need to be ramped up. I think more things will be created, more efforts will be underway because it's important. That's it for me. Thank you. Victoria, thank you. Same question goes to Victoria Sukhareva. How has the war transformed the public's idea about the importance of mental health? What are the key needs that you see? Hannah, COVID and the war is a poor pretext, but at least it brought this problem to the public eye. So we know that mental health is not just about seriously disturbed people in treatment in hospitals, but that anybody basically can be affected. And there's a shift in thinking, and I think psychotherapy has been normalized, because in the past people thought that psychotherapy is just not a place to go unless you're seriously disturbed. And now an average person knows it's okay to go to a psychotherapist or a psychiatrist. It was normalized, and it's a good thing. Also, on the national level, we see some consistent support. Today, we had a discussion with school psychologists, and they need to support the children and the teachers and to detect early if there's a problem, so that they can support kids at kindergarten or school children at school or at university. And also it's a good idea to have a psychologist in different organizations. So these are new developments. These ideas were not in place before. And now there are places where services are offered free of charge. Not all people in Ukraine can afford that treatment, but there are so many NGOs these days that are doing different things, and people go to them and get help. So we see a decrease in stigma. Going to a psychologist means I'm crazy. No. We see that so many people have been affected by explosions or something, and they can go and seek help. And that has not been the case in the past. Nobody will judge you now. So it's an understanding that mental health is not concrete, is not solid. Sometimes it may bulge and crack, and it's okay to go and heal it. So we now know that we're under chronic stress, and therefore our old coping strategies might not work any longer. So this chronic stress leads to our exhaustions. We feel exhausted, and people are gradually becoming aware that their psyche has limits of durability, that you cannot endure absolutely anything. No, there are limits what one can endure. And in the past, we had these ideas like, okay, you're not allowed to complain, especially if you're in the west of Ukraine, you're not allowed to complain. And it's challenging. People not always can get help. Yes, there are NGOs, but not all people know about them. And the funding has been disrupted. It's a recent development, and therefore some of the NGOs can no longer function because of the disrupted funding. I think what we're trying to do right now is to set up a system of service delivery. It would be ideal that people could swiftly access the services. It would be better if it weren't the system of a friend knows a friend knows a friend who knows somebody who can deliver mental health services. I wish it was not the case, but it is the case right now. I wish there was a solid framework where people could go and seek adequate service. But we have seen numerous cases where word of mouth has really helped people find a mental health professional, but it doesn't always work. Victoria, all right, thank you. So we've known Victoria for a number of years, both in Sumy, so we can read each other's expression very well and guess when she would wrap up her remarks. And I go to the next speaker, Vitaly Khristenko. Same question to you. Has the war transformed the public's idea of the importance of mental health? What are key needs evident right now?
Well, first and foremost, I would like to say that I agree with both Victorias. And I would like to clarify some things. We have been working in Kharkiv all the time. We didn't leave the city. And we keep on working with the citizens of Kharkiv. Quite often we have to work with those who lived in occupied communities. We observed such a picture. When you come to a community for the first time, there is a certain level of distrust. Well, that was the case even before the full-scale invasion. But after one or two visits, the head of the community usually tells us that we are welcome, and they ask me to bring psychologists to the community. As usually, we go in teams together with lawyers and with social workers, but at certain point, they actually confess that those are psychologists that are in demand. Therefore, there is a shift in attitude to psychologists and psychology in general. The attitude is much more positive nowadays. If I have an opportunity, I will jump on later, and I would like to dwell upon the mistakes that are made by volunteers and psychologists. As yes, we mentioned the quality of psychological assistance. Well, yes, that is true, but unfortunately, we are understaffed. And unfortunately, Ukrainian educational institutions do not train too many psychologists. And in some institutions, the quality of that formal training is not that high. We work not only in the city of Kharkiv, but we also work in the region of Kharkiv. Well, since you brought it up, please go ahead. You mentioned some mistakes that are made by volunteers and psychologists. Please elaborate on that. What are the skills that are required to offer help in a professional way? What are the lessons learned? Well, I saw from my experience that there are not so many psychologists who are able to work in the fields, so to say, as they are used to work in their offices. But sometimes they need to make field trips, and in general, there is a lack of psychologists. Quite. I would like to ask you to turn off your microphone, please, Oksana, if you don't mind. Please turn off your microphone. Sarah, could you interfere and turn off your microphone? Thank you very much. Well, I do understand those who are trying to provide psychological help, but they lack knowledge and they make certain mistakes. The biggest mistake being that they start a lengthy process of healing with people with whom they do not have that much time. What I mean is that you cannot go to a certain community on a daily basis, and instead of offering the emergency assistance, emergency counseling, they begin the long-term process of therapy and then they end it abruptly. They just leave it ha halfway. And those who use this type of help are remain disappointed. Thank you for bringing that up. All right, now let's ask Alexander. I saw him on our meeting. All right, Alexander, the same question goes to you. This is a question to Alexander Vasilkovsky. How does the attitude changed in terms of the psychological counseling? And my understanding is that you are working with military. Yes, that's correct. I am the head of the team of psychological support, and I am a serviceman myself. I am also an associate professor mm, at Kharkiv National University. You mentioned that earlier, and I'm a colonel. Since 2022, I saw a shift in the worldview. As before that, we were following the Soviet tracks, and we were working with the personnel, and it was just a general training, which is a part of the comprehensive training. But since 2024, the armed forces of Ukraine actually changed the attitude, and now we are offering psychological counsel and psychological support. It also entailed changes in our organizational structure, starting from the Ministry of Defense of Ukraine, and the headquarters also saw certain changes. The command officers also are aware of the changes, and at the operative level, some changes were made. The army branches commands have been changed. The company commander is also aware that certain changes were introduced. What are those changes? Now we have the units that are called the Team for Combat Stress Control. And another team was introduced, that is the Team for Psychological Support, Psychological Recovery. Those are the military psychologists that are members of those teams. These teams are engaged in offering first psychological help. And they are helping they are helping military on a three-tier system at the level of battalion and platoon. There are first psychological aid facilities established, and the emergency psychological aid is provided within 3 days. We talk to all chains of command in order to support psychologically people who serve there, particularly with those who have certain personality disorders, mental disorders, and we are hoping that now there will be the due referral process for those who suffer from certain mental disorders, and we hope that they will get timely help. On the 27th of June, we will celebrate the 3-year anniversary of the work of a unit that introduced this system in 2022. We have the special centers that use the special programs for psychological mental rehabilitation. After recovery, those servicemen return to the places of their dislocation, of their deployment. Therefore, the changes are drastic, and if we are talking about the quality of the psychological aid and of the amount of psychologists, yes, we are understaffed. Even though, according to data of the Ministry of Education and Science in Ukraine, we have over 15,000 psychologists uh, that were qualified and they got a degree, a university degree in the past 10 years. And yet I wonder, where are all those people? Some of them left the country, and maybe we have 50% left, and maybe they understand how to provide the proper aid. But if we actually take into consideration the quality factor, probably this number will narrow bin this figure will narrow down to much less, and only small share of all those who were formerly trained in psychology are able to provide quality assistance both to the armed services of Ukraine and to National Border Guards of Ukraine. Although we do need these professionals, as they could substantially improve the morale, and they could substantially change the situation even on the battlefield. Yes, the changes were introduced, but yet there is some fine-tuning. Thank you very much, Alexander. You mentioned many issues, and yes, now we need to address them jointly. Now, I have a question to Victoria Sukhareva. She works at a hospital for war veterans. And my next question is as follows. What are the best practices of working with veterans? Well, I wouldn't call those best practices, well, good practices, let's put it this way. Good practices that are already in place, the practices that you could share. And I'm sharing a link to a booklet that was published under the edition of Victoria, under the editing of Victoria Sukhareva. What are the good practices that are worth sharing, and what are the practices that require improvement? Well, I should say that I remember this one case. It was a success case. There was a brigade that was in the Sumy region, and I had a positive experience of communication with brigade psychologists. They told me that they went directly to the places of deployment of military, and they were providing assistance to those military. They were also diagnosing them, and they were taking notes. It helped a lot because this information was very useful in terms of making decisions. I'm a doctor, but when a patient gets to our hospital, we send the patients to psychologists as a measure of primary screening. And in those particular cases, when I had this information sent to me prior, I was able to act swiftly, and I was able even to prescribe some medicines or certain procedures. And they also told me that there is actually benefit in our work. I also had an experience when there were psychologists who wanted to follow military to all medical examinations. And well, actually, those people were not psychologists. They were just holding these offices of psychologists, and they were following military simply because it was required of them. Unfortunately, they were not trying to help. But in that particular case of a brigade psychologist, that was a success story. Unfortunately, now they need to leave, and that was an amazing experience. And actually, they were there to study. They had certain experience, but still there is something to learn, as particularly if in the field of psychiatry they were open to new knowledge. And that was the first time when I saw some weird psychologists, but when there was these teams of psychologists who were open to cooperation, who were open to learning something new. That was the good practice I would like to share. And another story I would like to share is the story of wives. As sometimes wives come to us and they ask to be taught some tricks, or they want some advice. Sometimes they accompany their husbands to the hospital. And on the other hand, there are cases when women were asking us to treat their husbands, and they were complaining that their husbands were sick and they were mentally ill. Well, that was a negative experience. Anyway, we were able to control this experience, and we needed to monitor the state of the patients long term. As if we prescribe medicines for a month, there will be no quick results after that. And of course, it would be also good to have communication with those who work with our patients, those who serve with them after they are discharged. And until recently, there was this attitude that psychologists are not needed. In one unit, I know that there was a positive attitude to psychologists, and they were working with us. They were asking our advice, and they were sharing some techniques and some practices. And I was amazed that actually in military we're using those techniques of psychological self-help. Thank you. And now I would like to give the floor to Victoria Rateva. And my question is about the methodologies and techniques that you use for those who have been affected by the war. Well, the skills that we are applying mostly are the skills of self-help, and we are trying to teach this particular skills. For instance, breathing techniques, trauma focus therapy, cognitive behavioral therapy. Well, yes, I believe in all these techniques, and I have been in therapy for years myself. Well, all these skills are required, are necessary for psychologists, especially in the cases when they simply work with the military for a couple of days only. And these are the concerns that are usually voiced by the psychologists, as sometimes they want more support from those who are um, who are communicating firsthand with those military. And yes, as a part of the awareness campaign, I believe that we need to explain that there are various fields of our work. I am actually focused on work with civilians. I work at the university and I work at various projects. As of now, we have an interesting project. That is a project aimed at supporting female combatants. We were using art therapy. Those art therapy techniques proved very efficient. And if someone is interested in reading additional sources of information, or if someone is interested in learning more on YouTube, you may find breathing techniques, or you may download certain apps in order to improve your mental health. Well, of course, this cannot substitute the in-person communication. Of course, when someone wants to talk to you in person, this is about communication. This is about having conversation. But I agree with Vitali on this one. When people started leaving um, the occupied areas and we came to those communities, we realized that we need to change and our tactics right away, as we need to act quickly. There is no certainty that you will be back in a week's time. Therefore, you have to act now. I actually had this case where what was that? There was a village that was liberated, Rojba, and it was, I don't remember, Basdrik. Well, this is a community close to Sumy, Baromla. Okay, that was Baromla. We went there and we decided that we will return in 4 days. I took my notes. I explained to them that we'll see you on Thursday at 9 a.m. and I fell ill. My colleagues told me that people were counting on me and they were very disappointed with my absence. Therefore, I realized that I have to act differently. When I go in there, I give my phone number if needed, or I explain how they could get more information. And I understand that in case of crisis, I do 1, 2, 3. But in cases where I offer therapy and I have an office, that is a completely different story. Or in case of someone been admitted to the hospital. In these 3 years, we learned a lot. I learned to structure my work on a different way. And of course, we could use different areas of psychology. And I believe that all of us find the right tools that we feel most comfortable with. And I believe that this is the way to proceed. as it depends on our experience. The longer you work, the better you are at what you're doing.
We've also started coordination effort because there are some psychiatrists I know I can refer people to. So we work as a team now. I can refer my analysand, my client, if they need some psychiatric support. We live in the areas close to the front line. We've experienced a lot of acute stress, and colleagues do some field work, and therefore we're trying to support the civilians and support their mental health primarily. And we're drafting short programs, we're drafting guidelines just to stabilize the individual. But you know, people have so many different inquiries. By the way, talking about PTSD and post-stress growth, we started working with Hannah back in March 2022. I think we had a vague idea of what we were doing during our first training sessions, but the attendance was rampant. I think we had most people, we would get 170 or 180 people, many attendees coming. Maybe it was done over Zoom. We had some internet connection at the time. So I think back to that, and I remember us focusing on first psychological aid back in the day. Now people want something, you know, more about evidence-based service, about resources, not just fast track intervention, but they seek something similar to long-term therapy. They want to attend regularly, and this has a healing effect, and it's a positive trend. For example, you can tell a person, okay, we have 5 sessions. Our setting can be once a week. We can do comprehensive work. We can explore something with you. We could discuss things with you, reflect on things with you. And this is a major advantage already. Which techniques are we using? Art therapy, metaphorical association cards, other types of therapies, psychoanalysis, Bible therapy, canine therapy. It's a broad range of therapies that are used these days. And so many things can be used and they are helpful, like mindfulness techniques, for example. Take mindfulness. Victoria, thank you. Thank you, Victoria, for your intervention. Victoria, I know you've put together a guideline that you might want to share in the chat. Please feel free to use any handouts in the chat. And Vitali's work and words resonate with me very much with Spain. I do a lot of volunteer effort. I secure funding for the psychologists. They are overworked. And at the first days of invention, people just went and drove to the village of Vorosba. It was affected by the shelling. It was shelled yesterday and the psychologists come in the very next day. All of them are volunteers. People would give donations for fuel just to drive to that village. And these examples are abound. So I second your idea, Alexandra. There's a shortage of mental health professionals. They are being trained, but that's by far not enough. Okay, with that, I will pass the floor to my co-moderator, Ihor. As a reminder, feel free to put your questions in the chat. I see Marta's question, I see Oksana's question. We will get back to them when Igor will give you the floor. So, Ihor, now over to you. Hanna, thank you so much. So, we've discussed a fair number of questions pertaining to mental health support to the civilians and mental health support to the military personnel. You mentioned when the full-scale war started, your example of self-organization. And therefore, I have a question to Alexander. when the full-scale invasion began, he was the head of certain military authorities, and therefore he knows some of the practicalities on founding and launching and rehabilitation center and the next center and the next center. He knows all the ins and outs. Therefore, my question is to Alexander, how exactly did you do it? What challenges did you face at the beginning of the war? What did you do to ensure an opportunity for our military to recover mentally, physically, and for them to enhance their opportunities so that they can return to combat missions in the future? Ihor, thank you for your question. For all the panelists, I can say as follows. To do things, you need knowledge, experience, and expertise. You need to lay the groundwork for what you're doing. Otherwise, all of that is forgotten. If I have some time, I can walk you through that process from the very beginnings. So, since 2014, I've been at war. I have held certain offices. I was second in command of the brigade when it comes to psychological support. I will not expand on it, but just to mention that I was on Svitlodarsk Arch, and during 3 months we've seen 12 successful suicides. So you can have an idea of the expertise that I have. So during the beginning of the full-scale invasion, it dawned on me that 6 months into we would face immense challenges. That is one. Second, I studied the conflicts over the last 50 years. Namely, I focused on two big conflicts, the Vietnam War, 1963 to 1973. It was a lengthy conflict, and the second lengthy conflict in the Soviet Union, beginning in 1979 to 1989, the Afghan War. So we have the Afghan War veterans. So these were real war veterans. They participated in combat. These were inhuman conditions, traumatizing for the human psyche. So, in contrast to the US, the conflict ended for them in 1973. The US has seen an increase, a 260 increase in drug abuse, which leads to people behaving off the rails and therefore posing a threat to society. If these people group together, that poses a national threat, a threat to the whole country. Therefore, I thought what might happen to our military personnel in 6 months? How can their mental health backfire on them and on the entire country? And that led me to create a station in the Kharkiv axis at a well-defended forepost, and my station was called the Mental Health Recovery Station. We renamed it subsequently, different names we used for that place. We held discussions on the right naming, and we held 1 week program of decompression at first, but then we switched to 14 days mental health rehabilitation program. And in the future, we're planning to switch to 21 days because 14 days is way too short. So we're thinking of switching. So I was drawing from the knowledge that I'd already had, including my expertise in public administration. I thought that what I can do well is to organize processes, launching things, ensuring support, adequate resourcing, controlling, i.e. I was a manager. I was ensuring adequate management. Ihor helped me a lot, and we had the third person with us, a PhD, Dr. Maxim Baida. He's also in the military. He also has a rank of lieutenant colonel, and the three of us created the very first center. 30 military personnel were our first group, which was a major test for both of us. It was a test for the participants, it was a test for us, the founders, and for the mental health practitioners staffing the station. And 1 week later, tears were brimming over our eyes because the mission that we were tasked with was to ensure the balanced mental health prior to the counterattack on the Kharkiv axis. Therefore, we had to boost the morale, we had to remove the panic attacks, all the fears plaguing the morale of the troops, because it has a major impact on the combat efficiency. 1 week into the program, we convened a meeting where we exchanged opinions with the medical doctors. They participated in the meeting. The psychologists, Ihor and Maxim, were also present there. We had feedback session, and all the 30 attendees thanked us. Thank you. We feel alive again. We are ready to rejoin the battle. This was unbelievable. I couldn't believe my ears. We didn't believe for a moment that would happen, but it did happen. And that happened with every new group. The other group was 30, the next group was 50, and then 100. So we kept up that standard of serving 100 troops per week. Presently, we can rehabilitate up to 250 per week, but there is a big challenge. We are under-resourced. There's a lack of military psychologists, so the psychologists specializing in working with the military. Unfortunately, most civilian psychologists are not as effective for the military audience. The military react badly to them. It's a fact. The military don't listen to the civilian psychologists, and it's a fact. Because the soldiers question the civilians. Have you been out there? Why do you ask me about my experience? Why do you want to meddle with me? Because the military want peer-to-peer level conversations, but when it's a military a person with military rank talking to another soldier, they get on pretty well at once. So we created that station in the Kharkiv region, but then we ran into a big problem because of the shortage of funding. It's a thorny issue. The government doesn't provide any funding. It's not allocated in the state budget. To allocate those funds for the Ministry of Defense, for the Ministry of Interior, it's too hard to do. It's not possible these days. In order to do that, the law needs to be amended. 2 Cabinet of Ministers decrees need to be amended. 3 laws of Ukraine need to be amended. 4 decrees of the Ministry of Defense need to be amended. And even the presidential decree on establishing of National Rehabilitation Center network needs to be amended. These are the centers specializing on serving the military. However, there is another stumbling block. Much to my chagrin, after a range of economic reforms in Ukraine, some companies and state-owned enterprises were privatized because of their bankruptcies. Therefore, it's saddening that 98% of the so-called sanatoriums or rest facilities that have the capability for rehabilitation services are now privatized. So they're in private hands now, even though they used to be owned by the government. So the recreational network for the troops is no longer in place. Therefore, rehabilitation of the troops on those sites is almost impossible. And it's only the National Health Service of Ukraine that can organize these recreational activities. And I speak as a Ukrainian national, not as a military staff. You know, looking at the capability of such a facility, it needs to be staffed with the healthcare workers in line with all the packages of rehabilitation, package 53, package 54. So the facilities are understaffed. They don't have enough of healthcare staff to provide adequate services. For example, if you have 50 beds, a facility with 50 beds, or a facility that can only accommodate 50 soldiers, this is nothing. It's nothing, really. Therefore, to close the funding gap, we accept donation, humanitarian assistance, and we accept donation globally. They come from the US, they come from the EU countries, etc., etc. Because somebody has to foot the bill. Yes, we are receiving continuous funding almost from the Western partners, but it's our government's responsibility. It's not the Western governments who should sponsor this, because the consequences for our country would be staggering. Because imagine a person who has seen a very thin line dividing from life from death. They wield weapons professionally, and they will pull the trigger. They will not balk at it. Imagine a person that is hypervigilant, that is outraged at the situation with the civilians inside. Imagine what would they do? I looked into these issues. I translated scientific work by John Sharp, for example, an American scholar, and another scholar who wrote a practical guide for the coup. So you would have millions of people like that forming a mass who have extensive experience in killing, and they wouldn't stop at that, and they might as well just lead a coup in Ukraine. Therefore, revolution is inevitable. Civil war becomes inevitable in this scenario. So what we're trying to do for 3 years, we've been trying to do it for 3 years now. Basically, what we've been trying to do so far is to make sure people are reintegrated in society in the future so that they behave more or less reasonably, more or less. Second, we want to win this wretched war. We want to defeat the enemy and to try and ensure that these people can socialize and come back to the public, at least with at least some war veterans. We're trying to reskill the war veterans, to add to that, to find employment for those veterans. So, all things taken together, this needs to be funded by the national central government. These measures should be directed at restoring the economy. The country needs to develop economically and socially, and soon. You also need a solid safety net, a powerful safety net, so that the troops could have medical rehabilitation and mental health rehabilitation, so that every medical service is delivered to them. And what they direly need is psychotherapy, family therapy, where they bring their children, they bring their wives. Because just imagine what happens in every family, where the soldiers come back for 3 days, for 5 days. It's devastating to the families themselves. It's a devastating experience for the wives. Because we have known cases of grenades being thrown, of wives stabbed, of wives shot at. This is shocking, this is staggering, and this leads to the downfall of our nation. Our nation is being destroyed by the enemy, but it will be equally destroyed, unfortunately, by our own citizens. Therefore, we need to have a clear understanding, and we need to act swiftly. And we need to act as much as we can and work as hard as we can, relentlessly. Therefore, we will undertake every effort to make sure that people who return can act more or less reasonably. Whereas you, the civilians, you need to help us to prepare the public for the return of the war veterans. Just imagine who would come back. They will never be their old pre-2022 selves. You need to be aware of that. So I think it's not just my task or Ihor's task or this panel task. No, it's a national task. It's a national goal. The government needs to address that goal. And we need to achieve it. Alexander, thank you so much. You have raised a very pertinent, thorny issue. It is an urgent question right now and for the future, and all of us need to think about it. Thank you. I also have a question to Vitaly. Vitaly, so you work in Kharkiv region, and some of the areas were liberated from the Russian occupation. They were temporarily occupied by the Russians and subsequently liberated. So, how did the residents of those areas feel in terms of mental health? How did the residents who were living under the Russian occupation feel?
Probably everyone heard that for about 6 months, the part of Kharkiv Oblast, about 30% was occupied. And as Alexander has already righteously mentioned, it was deoccupied later. Well, first, I would like to digress slightly. Victoria said that when you go somewhere, you cannot give your phone number to everyone. Well, whether you can or not is a different story. But I managed to resolve it. I created a QR code of my Telegram channel. And I said the following: for those who want to contact me, I'm going to leave, but I'll stay in touch. So all those who want, you can scan it. And we're going to get in touch by means of video calls, etc. This allows you to speed up the process. However, not everyone can scan the QR code. But as experience shows, there always will be people who are capable of doing that and they are willing to help others. Now, when it comes to what Ihor asked, well, what we observed shows that clearly something differs, other things do not. I'm not going to take up a lot of your time. Of course, we're talking about the traumatic stress. People had to experience shells, etc. And the thing is, when people were under occupation, our military tried to do their best to not shell those localities. But when the Russians were leaving them, and I know that for sure, they were ordered to destroy locality completely, to erase it after they leave it. And people, when they were under occupation, everything was quiet and fine. But when Ukraine came, it turned into a horror. They were shelled, destroyed, and many people don't understand why is that happening. And many of them get the impression that, oh, okay, Ukrainians came back and everything turned into a nightmare. You understand the correlation that these people have, right? In addition, many people are dealing with the feeling of loss. Some lost their property, some lost their houses, lost their friends, family members. And of course, this results in the loss of hope. Also, psychosomatic problems. I guess you'll understand what it is, what happens to your body when you're in that state. Also, different problems that children and teenagers are facing. It can be anything. Some start eating paper, etc. The feeling of hopelessness and helplessness. And I'd like to give you one quick example. There is a village, Lipsy, that is very close to the border with Russia. It was occupied on the first days of the full-scale invasion. After its liberation, we came there and saw that in one house that was almost fully intact, there were 7 men who stayed there. All of them went through torture by Russians. This united them and they started living together. And when we saw them, it's not that they were not talking to one another. They were not even looking up. They were only looking at their own feet, let alone they were not brushing their teeth, etc. No one there is even thinking about their future or any future plans. Twice, when we came there, the 3 of us worked with them. We at least managed to help them to start talking and looking into the eyes of the interlocutor. You probably understand that they were so traumatized that it is hard to overcome this trauma rapidly. And by the way, 28 torture rooms were discovered in Kharkiv Oblast. All of them were created by our neighbors. This is only part of the torture rooms. It is impossible to detect all of them due to the heavy shelling. And such torture rooms can be found in almost every locality that was under occupation. Also, many people are facing with the syndrome of postponed life. They think that now is not the time. We'll do it later, sometime later, someday in the future. I'm gonna get back on track. I'm gonna get back to my life. And as a result of that, people act the way they act. And it is incredibly difficult to work with people like that. And another phenomenon that we observed is that many boys aged 7 to 10 started acting as a father. And by the way, their mothers allowed that. And they behave like adults, grown-up men. You come to their courtyard, the kid comes out, the mom is behind, he turns and he says, no, you go stay at home, I'll figure things out. And the mothers let them resolve everything. So children are becoming adults in a blink of an eye. But at the same time, we cannot exactly call them adults. But this is another phenomenon that we came across. On the one hand, a kid is acting like an adult, but at the same time, I understand that this is still a child. We also observe that in girls, but it is not that frequent. So this is in a nutshell, to not take up too much of your time. These are our main observations. Thank you so much, Vitaly, for your response to this question, for your work. Today, we're talking about very acute issues, about very complex issues, but maybe it's gonna reveal these challenges to some people. Challenges that those people who were presenting just now are dealing with 24/7. That is why we must talk about it. We must raise awareness in the society about these problems. We must convey the need to resolve these issues. That is why I believe that we achieved our main goal. We looked at the peculiarities of the mental health in Ukrainians. And now I'd like to give the floor to Hannah to probably sum it up, to respond to the questions, and maybe also provide some suggestions that were made by all those who joined us, those who presented, and those who listened to us. Hannah, over to you. I see Vitaly Hrustenko raising his hand. Would you like to add something? Because I would like to move on to the questions from the participants, and there are already 3 questions in the chat box. I'll be very brief. Another thing that we realized that BST methodology works so good. It takes only 20 minutes, but people feel a strong relief. Thank you. Thank you so much. Okay, so first question by Marta Nikos. Most likely there's a question to Victoria Sukhareva, because you mentioned your work with students. How are you dealing with the middle school and high school students, and how are the teachers trained? Do you have experience of training school teachers? Because you have briefly touched upon that. Well, this was the first time it happened today, and this was postgraduate education. The SUNY University of Postgraduate Education invited me, and they shared some resources, links to different platforms that are well known, and they mentioned the law. So from what I understand, that this institute is dealing with that, as well as those psychologists who are overseeing the work of school psychologists. I know that there are some projects that are trying to engage people, and maybe I don't know, there is some kind of structured training for them. I'm not sure about them. I think most of them are self-trained. And when I was preparing to go and visit them, I realized that they also provide lots of resources for children, special notebooks, stabilization cards about what can be done in a shelter, or what can be done with a teacher when you all proceed to the shelter. So they had a lot of this kind of practical materials, also books about war, and they're trying to share that on their platform. You can visit it. There is a link. You can even download things. You can even ask them for some brochures and manuals. There are lots of resources that are aimed at children. So it's not going to be overly complicated or complex, something that is suitable for children of a specific age group. Okay, amazing. Mental health program that is titled How Are You? I'm going to share the link in the chat book. There is a question from Sarah Phillips. You have mentioned a 20-minute methodology that works very well, but I couldn't get the name. Could you please repeat the name of this methodology and tell about it a little bit. This is called biosuggestive therapy. So people are seated. I'll send a link to their website where you can also find information in English. Thank you so much. There was also a question to Ihor Prihodko, who mentioned that all of us are going through the third stage of stress. The question is, what are the consequences of this third stage of stress? I believe that you already replied to this question in the chat box, but maybe you could tell us what are the threats?
Yes, I'd gladly take that question. I would like to repeat that on the third stage of stress, it is the time for either post-traumatic growth or for post-traumatic distraction. By distraction, we mean abuse in alcohol or narcotic substances, gambling, and other addictions, and negative habits. Unfortunately, people who suffered from stress, be it war stress or other type of stress, they are prone to this type of addictions and disorders. Unfortunately, for military, the processes are more acute since they had a longer exposure to the stress factors. Therefore, they had actually experienced the risk of losing their health and life. Therefore, it transforms the mental health of a person drastically. Yet again, I would like to reiterate that not everyone who suffered from post-traumatic stress would have a post-traumatic stress disorder, since PTSD is a mental illness that has certain symptoms. I'm sure my colleagues would agree. And those symptoms manifest themselves through certain periods of time. There is certain regularity and pattern to those symptoms. Without external factors that Alexander mentioned, our country and our society in general has to understand what are the probable implications of this current events in terms of the mental health of the citizens. And also internal factors matter a lot in terms of the predispositions of a person. When we speak about post-traumatic growth, we intend the situations when people who unfortunately had heavy injuries, who had their limbs amputated. Unfortunately, some of them become very reserved and they withdraw from communication with the others. On the other hand, there are those who, on the contrary, become even stronger and more resilient despite the situation. These people find their places in society. They find supporters around them, and they start different life, taking into consideration all those changes that they had to sustain in terms of their physical health. Thank you. I believe that we can wind up on this note. I do not see any other questions from our participants. You can find us on LinkedIn, and Victoria Suharova and I, we are on Facebook. Keep in touch. If you have any questions, let us know. And you can also reach out to Sarah Phillips, one of the organizers of today's conference. Maybe sometime in future we will have another event dedicated to this topic. And glory to Ukraine! Glory to heroes! Dear colleagues, our final last roundtable for the day caused a lot of deliberations, and I was thinking a lot about that. I would like to thank all the colleagues for all your work, and I would like to express gratitude to those colleagues who work in Sumy and in Kharkiv, who work close to the front line, who work at the front line, and who work with people who are very vulnerable at the moment. Thank you for your work, and thank you for helping those people to get back to the society, to get back on foot. And I would like to mention one thing. In the United States of America, there is a tradition of expression of gratitude to military. And I would like to thank Alexander Vasilkovsky on behalf of all the participants of this conference. Thank you for your service. Thank you. Thank you. I serve Ukrainian people. Glory to Ukraine.